All right, good afternoon. I'm going to do something a little different. I'm going to actually take some old PowerPoints and kind of slim down what your book has. It's the same information, but your book had over 121 slides, and I wanted to condense it to really get to the meat of what we need for chapter 14. So chapter 14 is definitely dealing with the brain, and we know the brain is a part of the central nervous system, and it's also going to deal with some cranial nerves. So the first thing we're going to start out with is identifying the major parts of the brain. So the adult brain has four major parts, as you can see from the slide. We have the brain stem, which is going to include the spinal cord, the medulla oblongata, the pons, and the midbrain. Then we have the cerebellum, which is like the little hind brain that kind of sits in the back, or some people say like the butt of the brain, right under there. And then we have the diencephalon, which you can't see from this view, but if we were to cut this and we'd make a mid-sagittal incision, we can actually see the diencephalon. And then we have the cerebrum, which is the largest part. That is the piece that we are used to. Now, inside of the brain are ventricles, and the ventricles, their entire purpose is to transmit or transport CSF. CSF is cerebral spinal fluid, and we know that it has nutrients in it so that it can transmit all of the goodies that our body needs for the brain to function. So let's look at some of these ventricles. So 4 ventricles altogether. 2 of them are called the lateral ventricles. So the lateral ventricles is 1 in each hemisphere. So you have the left hemisphere of the brain and the right hemisphere of the brain. And more specifically, they're in the cerebrum. And they are separated by something called the septum pellucidum. And I'll show you that in lab. And CSF is formed here in the chord plexus. So I really need you to key in on this part right here. Then we have the third ventricle, which sits along the midline between the right and left halves of the thalamus, and then the fourth ventricle, which lies between the brain stem. Now, what you see in the lower right-hand corner is a child, what we call water on the brain, or waterhead. They would say the child is a waterhead. What it actually is cerebral spinal fluid has been blocked in one of these ventricles, so it's not flowing properly like it needs to. So what we end up doing is putting a shunt to drain the fluid. Now, the reason that the baby's head is able to expand like that is because what you have to remember is the bones there have not fused, so there's still soft spots, or what we call fontanelles. And because of that, they're able to stretch because they're made of cartilage. Now, once they are opened up to the point where we start going through endochondral ossification, where we start to have our flat bones kind of form together, which is intramembranous, I apologize, intramembranous ossification, where those cartilages begin to become solid and become bone, then we won't see that anymore. We'll just see the head swelling if there's some type of injury and the brain is swelling. That's usually what happens. We'll put a shunt in, and you won't see it expand as much as you see it in this child. Now we're going to go into the protective coverings of the brain. We talked about it for the spinal cord. It has the same name, which is the meninges. You have cranial meninges and spinal meninges. So with cranial meninges, what we see is the brain is cushioned with 3 different connective tissue membranes. And just like the spinal cord, there's a dura mater, there's an arachnoid mater, and a pia mater. And the overall function of the meninges is to protect the brain. We want to make sure that there is a structural framework is provided for all of the arteries and the veins, because we have to remember that our fluids are being carried in that area. We're getting oxygen, we're getting nutrients, all of those things to make sure that, excuse me, to make sure that everything is flowing properly and everything is getting the proper nourishment so that we can continue to function in normal homeostasis. Now, the one difference between the cranial meninges and the spinal meninges is that the cranial dura has 2 layers. So cranial dura has 2 layers. So we have the dura mater, which is the outer layer, the arachnoid mater, which is the middle layer, and then the pia mater, which is the inner layer. And I'm going to add a few more notes between, no, actually I'm going to leave it right there. Let's go into the CSF and let's go through this again. So CSF, again, is the cerebral spinal fluid. Now, CSF, again, stands for cerebral spinal fluid. It's very, I won't even say it's very, it is clear. It's a colorless liquid, and it fills the ventricles and canals of the central nervous system. And pretty much it bathes it, so it soaks in the brain. Now, the brain produces about 500 milliliters of CSF per day. The fluid is always reabsorbed, so it's constantly and continuously being reabsorbed at the same rate. And it has three purposes. The three main purposes, one of them is buoyancy. Now we know with buoyancy, if you think about the beach, and you always see that they have those buoys kind of sitting out there, so you know what line to cross and what not to cross. Well, this is the same thing that happens with the brain. So the CSF makes sure that the brain never sinks or floats in it. So the human brain, if you remove it from the body, it weighs about 1,500 grams. But if you put it in CSF, it only weighs about 50 grams. That's a huge difference. We're going from 1,500 grams to about 50 grams. Now, if the brain is rested heavily on the floor of the cranium or the seat of the cranium without CSF, the pressure would kill the nervous tissue. We talked about before how nervous tissue is so delicate that it can't maintain a lot of pressure without breaking down and eventually dying. Neuropathy. So that's why we need the importance of the CSF to create the buoyancy so that it continues to not float, not sink, but to keep the pressure off that cranium floor. Another thing that we have to have the CSF for is for protection. You think about driving down the street and how many times we have slammed on brakes and our head has jolted forward. The CSF protects not that, but your brain from striking the cranium when the head is jolted. If the jolt is severe, the brain still may strike inside of the cranium, but it won't be as severe as without it at all. Now, this is one of the common findings we find in child abuse. For example, shaken baby syndrome. We talked about that before when we were looking at the spinal cord. And then head injury, so concussions from auto accidents, and you can think about some of the great boxers or the boxers that we have now and how sometimes that they ended up with brain damage later on because of the pressure and all of the contact that their head is withstanding from punches over and over and over, not only in the ring, but also in practice and through training. One of the other or the last of the three things that we use CSF for or the importance is chemical stability. So CSF rinses and washes away all types of waste that comes from the nervous tissue. Remember, we talked about the neuroglia and how we have microglia that's inside or one of the parts of neuroglia that kind of get away all the pathogens. But the CSF is another way to kind of rinse it away. It also regulates the chemical environment. We have receptors that are present that continuously monitor what the levels are to tell the body what we need to do. If there's too much CO2 in the body or too much O2, if any of those things are too much chlorine, anything that would send a signal off, the CSF contains all of that information, and so the body would instantly know something is off. For example, if we had high glycine concentration, what that does is it will change the body temperature and blood pressure. So a high pH of CSF, if it's too high, we end up with dizziness and fainting because it's, the levels are way too high. We need to find a way to bring it down. It helps with getting shock absorption, nutrients. It carries oxygen and glucose to the neurons and neuroglia. And remember again, the neuroglia are they support the neurons. They're not actually neurons, but we also see neuroglia again with nerve regeneration. Neuroglia plays a large place in that. And if we could just remember how CSF flows, we know it goes from the lateral ventricles down to the intraventricular foramina, the third ventricle, the cerebral aqueduct, and then the fourth ventricle. we have the blood-brain barrier. What is the purpose of it? So the blood in the brain flows to the brain. The blood in the brain flows to the brain through the internal carotid and vertebral arteries. Very important arteries that we're going to see over and over again. Now, the brain receives about 15% of the blood and consumes 20% of the oxygen and glucose. Most neurons have a high demand for ATP, and therefore glucose and oxygen, we need a consistent amount of them. We need a consistent and regular supply of this glucose and oxygen. So it is critical to the nervous system. We often talk about what happens if a person does not receive enough glucose, or if a person does not receive enough oxygen. We know they end up fainting or passing out because the levels are so low. So a 10-second, just to put in perspective, a 10-second interruption in blood flow can cause a loss of consciousness. An interruption of 1 to 2 minutes can impair neural function. 4 minutes without blood usually causes irreversible brain damage. So that is the key. 1 to 2 minutes, again, of interrupted blood flow impairs neuronal function, but anytime we go over that, about 4 minutes without blood, that's usually irreversible. Now, also what we have to know about blood is that it's a source of antibodies, macrophages, bacterial toxins, and all kinds of pathogens, anything harmful that's trying to get inside. Now, damaged brain tissue is irreplaceable. That's what we talked about before when we were looking at just the CNS. Remember, the CNS has the brain and the spinal cord. That's it. So the brain must be well protected. The brain barrier system regulates what can go from the bloodstream into the tissue fluid of the brain. If you go back, that makes you think of chapter 3. I think it was chapter 3 when we were talking about the plasma membrane and how it was semi-permeable, and there was a bouncer, the semi-permeable membrane. The plasma membrane, we talked about, it's a bouncer, and it controls what goes in and what comes out depending on its shape, depending on its size, depending on its charge, all of these different things. Well, what we're going to have here is the brain barrier is going to do very similar work to make sure that the brain is protected, just like the plasma membrane makes sure the cell is protected. We see that the blood-brain barrier is going to regulate what can go from bloodstream into the tissue again. And there are tight junctions in that place to make sure that harmful substances don't get in. So if you remember tight junctions, we want them in places where there is liquid, and we don't want that liquid to go anywhere. So for example, you have tight junctions in your bladder because you don't want that urine to flow out into the body cavities. The same with the stomach, has tight junctions because you don't want that the contents of there, all the acidity, to flow out in the system as well. What we'll see is glucose is not stored in the brain, so the supply of glucose must be continuous. If you all have ever seen stale magnolias, we know that what can happen, you can go into diabetic shock. It'll cause dizziness and convulsions and loss of consciousness if there's not enough blood flow. Now, the brain barrier system is highly permeable to water and glucose, just like what we saw with the plasma membrane, and lipid-soluble substance such as oxygen, carbon dioxide, alcohol, nicotine, and anesthetics. And we especially know anesthetics because if you've ever been to the dentist, that's what they use to make sure that you're numb, or if you've ever had surgery, they make sure that you give you anesthetics. So the only way that is working to numb your body so that you can't feel what they're doing is because it is able to pass through the blood-brain barrier. Now, it is slightly permeable to sodium, potassium, chloride, some waste products like urea and creatinine. So the blood-brain barrier is very important in protecting the brain, but it does, because it's so protective, it also runs into an instance where it becomes an obstacle. It becomes an obstacle because it's hard to deliver medications like antibiotics, cancer drugs, and so that complicates how we can be treated or provide effective treatment. So these are just some of the pieces that I have written down that goes through them. Now, let's look at the brain a little closer. So the brain's divided into 3 parts. We have the cerebrum, the cerebellum, the brainstem, and that fourth one I mentioned at the very beginning, which was the diencephalon. You can't see it from here. Now, 2 key components that I do need you to know is the gyri and the sulci. Some people say gyri. So these big puffy pieces here that looks like, what do I want to call them? Honey Smacks, the puffy pieces, or when you buy something from Amazon and it comes with those little noodle pieces, that puffy part is called the gyri or gyri. Now the black lines where it looks like it caves in, that is called the sulci or the valleys. So the deep invaginations are the sulci and the folds or the big honey smacks is what we call the gyri. We have the cerebrum, which is the most superior part of the brain, the largest part. And I do need you to know all the pieces that is responsible for. It's definitely responsible for speech, especially more specifically the Broca's area, memory, vision, emotions, and reasoning. Okay. Each hemisphere is marked by thick folds called gyri and separated by shallow grooves called sulci. The longitudinal fissure present in the cerebrum separates the left and right hemispheres from each other. So if we were to cut this right down the middle, we'd have a left and a right. And we have the Broca's area, which deals with speech, and all of these motor and sensory areas. Now the brainstem is composed of the medulla, the pons, and the midbrain. The pons is a portion of the hindbrain. That little brain sits in the back with the medulla oblongata. Key piece here, it serves as communication and coordination center. So sometimes if our balance is off, or sometimes they make us take the sober test, what they want to do is make sure that your pons is in alignment, because that deals with coordination. If it's hindered in any way, which is very possible because remember, alcohol can pass through the blood-brain barrier pretty easily. We have the midbrain, which is the mesencephalon, and that is more associated with the motor side. Here's the hindbrain. So here we go. Look at this little part. This is the cerebellum, and that little tree is called the arbor vitae, or the tree of life. And if I was to stick a pin right through here, you would see that would be the lateral ventricles, and the piece that's around it. Everyone see that piece around it? Okay, so this right here will be the lateral ventricle. All right, the hindbrain controls the body's vital functions such as respiration and heart rate. It also coordinates movement and is involved in learned rote movements. So you learn how to tie your shoe. You learn how to ride a bike. Those things you don't forget. You may be a little rusty, but you don't forget how to do them. The limbic system is one of my favorite. The limbic system is a system that holds on to memories and good thoughts. And of course, it could also do the opposite and hold on to bad thoughts. There's so much emotion and behavior here. What happens if you walk into a room and someone hugs you and they smell like white diamonds? I always call it old lady church perfume. And so what happens is that smell stays with you. And so every time that you meet someone and they have that on, that's the first thing you usually think of. There's some songs that you hear on the radio that you haven't heard since 7th grade. And as soon as it plays on the radio, you can bring it right back up and sing the words. And you can always remember where you were or who you were with. That is because of the limbic system. Just like some smells can trigger memories. We just passed Thanksgiving, so maybe you smelled a pie or a certain type of flower that your grandmother or grandfather had in the house that made you think of them. So memory, we see, is tied in here in the nervous system with the limbic system. The diencephalon is the region of the brain that includes the thalamus, the metathalamus, the hypothalamus, the epithalamus, the prethalamus or the subthalamus, and the pretectum. The thalamus is found in the third ventricle of the brain and is responsible for sensory impulses. So above here we have the corpus callosum, and then that little dent in there would be the lateral ventricles. So then we have the hypothalamus, also very important. Very, very important because 8 of our major hormones, and when we get into chapter 9, we'll talk about this some more. So it is the control center of all autonomic regulatory activities of the day. Autonomic, we can't control. It is automatically doing it. So our heart, we can't say heart, it's time to beat, or lungs is trying to expand, or lungs is time to contract. We have no power over there. So the hypothalamus helps with that. It controls the release of 8 major hormones, temperature regulation, control of food and water intake, sexual behavior and reproduction, control of daily cycles and physiological state and behavior, and mediation of emotional responses. Now, when the hypothalamus is not working correctly, the wrong neurons, they go all sorts of different kind of ways. And when this happens, we know the body is out of whack. We're no longer in homeostasis. So this leads to faulty perceptions, making us feel that we're deprived and emotionally unsatisfied, and that's not true. It's simple hormone and nerve transmission kind of hiccup. There's a mix-up. So dysfunction of the hypothalamus often leads to depression, hyperactivity, abnormal responses to stress or disturbances in the brain, and the limbic functioning. All right, the medulla oblongata. The medulla oblongata is towards the back of the spinal cord. Very, very important. It controls heart rate, breathing, blood pressure, swallowing, sneezing, hiccuping, and vomiting. All of these things are controlled by the medulla oblongata. The structure is believed to be the key to how general anesthesia works. We talked about that a little earlier, and how the anesthetics depress the medulla oblongata so they cannot function as it normally would. Now, let's look at the functional areas of the cerebral cortex where a higher level of thinking occurs. So what we know is that it's divided into sensory areas and motor areas. We were saying before how the word sensory and afferent is used continuously. They switch them back and forth. And motor areas and efferent areas are used interchangeably. So the primary somatosensory areas 1, 2, and 3, as we can see right up here, deal with touch and pressure, vibration, tickling, itching, temperature, pain, and proprioception. So we're trying to see where everything occurs. How does it make you feel? So those are some sensory areas that we can test in lab as well. Number 17 is known for vision. 28, olfactory, which is smell. So these are some of the special senses that we'll talk about in the next couple chapters. 41 and 42 are for auditory, and 43 are gustatory, which is our taste. For motor areas, we have 4 primary. So 39 and 40 are Wernicke's area, which interprets the meaning of speech. So the words are translated into thoughts. Whereas 44 and 45 deal with speech areas. So sometimes you hear people talk about speech therapy and they'll say something about Broca or something about Wernicke. These are the areas that they're talking about. Now, there are 4 electrical waves of the brain, and we need to know the importance of them. So we have a record of electroencephalogram. So the EEG, and they're helpful in studying normal brain functions like sleep cycles, tumors, trauma, and hematomas. So we're going to go through each one and see how they're used to diagnose different patients. So the alpha waves are seen in all normal individuals when they are awake and resting their eyes, but they're not asleep. So if you think about you've seen your grandmother or older person say they're not asleep, they're just resting their eyes. That is very possible. So you can be standing in meditation, or you could be in prayer and you're awake and resting your eyes, but you're not asleep. Beta waves we see are during sensory input and mental activity. So going through anatomy and physiology class, or playing chess, or anything that you're concentrating on. Theta waves occur in children and adults when you're experiencing emotional stress, which is probably what you're experiencing now because we're getting closer to the end with finals. You also see this in brain disorders. And then we have delta. What happens with deltas occur during sleep in adults. They are normal and awake infants. So when an adult is awake and we see the delta brain waves activity, we know that there is some type of brain damage. Now, the cranial nerves, we have to learn all 12 and what they do. So, some of the ways that people use mnemonics to make sure that they can remember the order. I always use OOO to touch and feel very good vegetables. Ah, heaven. Someone else used on occasion our trusty truck acts funny. Very good vehicle, anyhow. So you can go on Wikipedia, Google, and find all types of mnemonics to remember them. But the cranial nerves are actually what they test when you go in for physicals, especially if you were growing up as a child. When you went to your wellness visits, they wanted to make sure that all of these senses, all of these cranial nerves work, because a lot of them are attached to either sensory nerves or motor nerves, or sometimes both. So here are our 12 pairs. We have olfactory, which is smell, cranial nerve 2, which is optic, which does vision, cranial nerve 3, oculomotor, which directs the eyeball, and pupil size. You've seen them place the light towards your eye, then bring it away and make you follow their finger or follow the light. They were testing your ocular motor nerve. The trochlear motor fibers for one eye. Sometimes we'll see that with people who have trouble with their eyes, and we'll look more specifically in that. And how we test to make sure that they work. For test 1, we sniff something aromatic. Test 2, an eye chart. Test 3, a pen light. And test 4, we use a pen light as well. Test 5, cranial nerve 5 is trigeminal. And this one is a large one because there's all kinds of impulses from the face, nose, and mouth. So that's a huge area. So we use a safety pin, hot and cold objects, a corneal reflex going towards the eye, move the jaw from side to side. Abducent rolls the eye laterally. People who have a tumor or this area, this nerve is pressed down, the eye is not able to move laterally. It will only go forward. It will only look straight ahead. It cannot move laterally. We use a pen light to do that. And then we have cranial nerve 7, which is facial. And we can do a taste test, smile, whistling, and a tearing test. Cranial nerve number 8, vestibulocochlear. That's when we see, sometimes you heard of people having cochlear implants. This is when we're testing hearing, sensory, and balance. And we usually use a tuning fork for this. For cranial nerve number 9, we have glossopharyngeal, which is to promote swallowing and saliva production. So we usually do a gag test or a swallowing test to make sure that that nerve is working. And number 10, some people say this is the major nerve and this is ever severed that we would die. And as we get further into the chapter, you will actually see, in the next chapter, you'll see how much cranial nerve 10 really plays a huge support part in our body. So it does one motor impulses to the pharynx and larynx, of course, but we can also do a gag and swallowing test for this. For 11, we have accessory cranial nerve. Cranial nerve 11 is the accessory nerve. It activates the sternocleidomastoid. We talked about that before, that large muscle that allows you to turn your head left and right. So we can do a shrug shoulders against resistance. The doctor will tell your child, he'll push down on their shoulders and tell them to kind of shrug or push their hands away. That's to test that nerve. And then we have the last but not least, hypoglossal, which is tongue movements. And to test, we tell them to stick their tongue out and move it back and forwards. Stuck. There we go. So we also need to know these disorders. So cranial nerve 3. If there is nerve palsy, cranial nerve number 3, the eye is down and out. So this is the normal eye. But this eye, you can see, is down and it's out. So it's down and moving laterally, okay, when it shouldn't be down. And we commonly say, oh, that person has a lazy eye. It's not that their eye is lazy. It's actually an injury of the nerve. So the nerve is somehow paralyzed and not able to bring the eye up and around. Cranial injury number 5, we talked about with facial. And this one, if an injury occurs here, the person has a problem chewing and loss of sensation of touch on the face. If you think about it, that's exactly how that works when you go to the dentist. They will make sure they find that nerve and they will put all kind of anesthetics there. Remember talking about the blood-brain barrier. how things can flow through. We want to make sure that area, excuse me, that nerve gets that medication so that when they're drilling or whatever they're doing in your mouth, you don't feel it, which is also why you have that sensation. You lose sensation on that side. That's why they tell you whatever side you had surgery on, don't chew on that because you don't have the sensation and you would have chewed a hole in your jaw. Hopefully not literally, but you wouldn't be able to feel it as you would normally. All right, then we have cranial nerve number 6, which is the abducent nerve. And what happens in this one is it will not move laterally. It will not abduct. Remember, abduct is going to go away. So this one is actually the one that has the nerve palsy, okay? Because it won't move to the left. It won't move to the left and abduct. Well, this is all of chapter 14 in the brain and cranial nerves, and that's going to be it.